Hello beautiful people, it's Tiara, your Wellness Beauty MP from Serene Beauty and Wellness. And today I want to talk about Ozempic. So if you're not aware, Ozempic is a medication that is used for type 2 diabetics, but it has also been recently approved to be used for weight loss in people who have a BMI over 30, so who are obese. There's a lot of misconceptions out there in regards to this medication, and I kind of want to discuss it today. There's one story in particular that I wanted to go over because I ran across it through social media about a month ago, and it involved a woman from Australia. And the story kind of grabbed my attention because the headline read, "Australian woman dies from taking Ozempic." So of course I did some research, trying to do as much digging as I can, and there wasn't a lot out there, but what I did read was she was prescribed Ozempic under the supervision of her medical doctor to lose weight. And she had been on the medication, not sure how many months, but she had been on it for a while. And apparently she was having some GI symptoms that her husband had actually reported to the media. He said she was having some nausea, vomiting, and diarrhea, which are all common side effects of this medication. She had ended up developing what's called an ileus, which an ileus is known as a bowel obstruction. So there's not any word out there that if they solely ruled Ozempic as her definite cause of death, but they are speculating that she developed the bowel obstruction because she was taking Ozempic. There's also very little information about if her doctor knew that she was having these issues and how long exactly it was going on, because the bowel obstruction does not happen overnight. So we do know that symptoms like nausea, vomiting, diarrhea, and constipation can happen while on this medication because the medication is known to slow down the GI system, which is why people, when they're on it, they feel fuller quicker and they also have a loss in appetite. A bowel obstruction can happen if you're not going to the bathroom regularly. So that is something that you do want to tell your medical provider if you're on this medication and not going. And we don't know if her doctor was aware. But if you're not going to the bathroom regularly, there's different things that can be added to your treatment plan to ensure that you're going to the bathroom. Another thing is, while on this medication, gut health is very important. So while taking this medication, you should consider good gut health, and those different things that you can do to make sure you're having gut health is eating food that is high in fiber, taking pre and probiotics, increasing your water intake to about 6 to 8 glasses of water a day, and again, making sure you're going to the bathroom regularly. You also want to make sure that you have an open communication with your provider. A lot of people on the medication are losing weight and having side effects, but they're afraid to report it because they don't want to have to come off of it. However, there is so many things that we can do that can also be added to your treatment plan to help alleviate these symptoms. So you want to make sure you notify your medical provider. And then another thing we can do is it can be as simple as just decreasing the dose. So always be open and honest with your healthcare provider about everything. I also want to add one more thing. Ozempic has been on the market since about 2017, and within the last couple of years that it's been approved for weight loss, there's been a lot of negative light shed on it. So I've done a little research, and what I found was there has been only 2 linked deaths to Ozempic. 20 cases of people have also developed a bowel obstruction while on it. But think about this. Tylenol, which is a medication a lot of us have in our medicine cabinet, has caused about 56,000 emergency room visits, 2,600 hospitalizations, and 500 deaths per year. Another thing I want to add is that the leading cause of death in the United States is heart disease, which if you're obese, it can lead to you developing heart disease. So it could ultimately end up being your cause of death. So dying from Ozempic is a very, very low risk compared to developing obesity and then developing heart disease or just taking plain old Tylenol. So I want to thank you all for listening. If you love this video, follow my YouTube channel at Serene Beauty and Wellness for more videos like this one.